All right, I'm going to go ahead and get us started. So welcome to everyone who is joining us today for our webinar. We are excited to have you join us as we talk about and focus on our health policy concentration here in our Masters of Bioethics and Medical Humanities program at Case Western Reserve. Just some quick housekeeping stuff. So I'll introduce myself. I'm Dr. Leah Jeanette. I'm the director of our MA in Bioethics and Medical Humanities program. I fill a couple of different roles in the department, but I'm also a clinical ethicist at University Hospital. The other thing I like to tell folks, I'm an alum of the master's program. So I graduated from this program 15 years ago. So it's very full circle to be on this side of the program now. I want to introduce our panelists today who are joining us. Dr. Sana Loue is a professor of bioethics, and she's the director of our concentration. Dr. Loue, do you want to tell us just a little bit about kind of your background and your role like in the health policy and concentration in the program?
Sure, thank you. So I have a very diverse background, which actually is a gift in the area of health policy and bioethics. So my undergraduate work was in social welfare. I have a law degree and practiced law for 14 years. I have 2 PhDs, one in epidemiology and one in medical anthropology. I have and I think I have 4 or 5 master's degrees, which all help me see the world from various perspectives. And all of that really helps to look at policy, which is not restricted to a single domain. So when we talk about health policy, we're really drawing from different areas. We're drawing from economics, we're drawing from public health, we're drawing from medicine, from bioethics. So having, I think, the multiple disciplines, for me at least, is a true advantage.
Wonderful. I want to introduce our second panelist. Kennedy is a current master's in bioethics and medical humanities student. She's about to graduate in about a month, which is very exciting. Kennedy, you want to tell us a little bit where you went to undergrad, like where your hometown is, and why you chose the health policy concentration briefly. We'll get into more detail, obviously, later, too.
Yeah, of course. Well, I'm originally from Holland, Michigan, but I actually went to undergrad here at Case, and I was able to hear about this program by coming to things like this, but also through some friends as well. So I knew some alumni, and that's what kind of inspired me to look more into the program. I actually chose health policy because it was introduced relatively near the beginning, and I have a past in pop health research, and I've worked in some avenues, institutes of health policy at Michigan State. So after hearing more about it from Dr. Loue and Dr. Jeanette, I decided to take the intro class, which we'll talk about later on. And then that kind of definitely solidified my passion for health policy. So yeah, that's why I chose to take it.
Great. Thank you so much. So we're going to briefly just cover the agenda. We're going to cover a little bit about Case Western Reserve and our School of Medicine. That's where our department is located, just so you kind of get a better sense of the greater university. We'll talk quickly about the program itself, and then really dive into the health policy concentration and how it's, what the goals are, how it was created, kind of those things. We'll cover application process and deadlines, student assistantships and financial aid, and we'll save time for Q&A at the end. So if you do have questions, feel free to submit as we go through the Q&A feature. I will save the questions till the end, but if something pops into your head and you want to ask it, submit it early, and we'll take a look at the end on which ones we'll answer. So as I mentioned, we are in the Department of Bioethics. Our department is located in the School of Medicine. This is just some kind of general statistics about our School of Medicine in terms of how the School of Medicine as an institution is ranked, both in Ohio and the US, but also in terms of research funding. I think it's important to highlight that. And there's actually quite a bit of overlap, as you can imagine, between the research that we do and its involvement with health policy. And so there's a lot that can go on there. The other thing that's important to understand with the way that our research works is it is not just siloed into the School of Medicine. So we have a lot of collaboration across schools and also across institutions in the city, also nationally and around the world. So we are very privileged to be in a place that has great research opportunities. And the sky is kind of the limit on how we think about funding and those kind of things. Dr. Loue, I know you've done quite a bit of research over the years and at both locally, or I would say not just both, but locally, nationally, and internationally, really working with a variety of folks.
I've been very fortunate. So I've done work in Romania and Switzerland and Uganda and Laos. And that's, in addition to being able to present at conferences all over the world and interact with colleagues all over the world. And I've also done, as you said, research in the US as well. So it's really wonderful to have such great research support.
So one of the questions that kind of comes up as we're starting to talk more about our master's program is why study bioethics and medical humanities, right? This is kind of one of the questions. I either get this question or like, what is bioethics, right? When I tell people kind of the work that I do, or I'm sure Dr. Loue, when you talk about bioethics, sometimes folks maybe aren't as familiar with that term in some respects. But I think what's important to understand about bioethics and medical humanities is how closely it is involved in healthcare. And as we know, healthcare impacts all of us as an industry, as a field of study, as people who seek healthcare and seek medicine or care for loved ones. So it's kind of an inescapable world. And because of that, there are ethical issues, there are medical humanities issues, and they very much can be related to policy and other things that come up. And in the world of healthcare, we see constant advancements in science and technology, and a lot of this can lead to ethical concerns. And while there's a lot of different questions we can ask, I think one of the big questions is what kind of values should inform policy and practice? I know, Dr. Loue, in your courses, there's some of this discussion, but there's a lot of questions to also ask with health policy. But at a very high level, it's when we think about how bioethics and policy interact, I think that's kind of one of the foundational questions we think about. So how does a bioethics and medical humanities study, how does a program like this enhance a career path? And Dr. Loue, you're actually a great example of how it is so interdisciplinary and multidisciplinary, interprofessional. There's a lot of us that come to the table in bioethics and medical humanities with a lot of unique expertise, skill sets, and are able to contribute to this conversation. It also means that it helps launch our students in a variety of professional careers. And so we see students go on to clinical professions, whether it's medical school or pharmacy school, dental school, PA programs, or maybe they're in nursing. We also see students go on to legal, regulatory, and policy work. Students may focus more on arts and humanities or become bioethicists. I'm one of those who, after this program went into bioethics full time, or other areas of academia. But the other thing that bioethics and medical humanities allows is for discernment for the undecided. Because of that interdisciplinary, multidisciplinary, interprofessional nature, it really allows students to consider a myriad of career paths while they're in this program, affording them opportunities to kind of explore. And we're really proud of that. So our program will be celebrating its 29th year this fall. We are one of the oldest programs in the country. Majority of our students do the program full time. It's 1 year, essentially 2 semesters, but we do have part-time options and we do have dual degree options as well. One of the hallmarks of our program is our customized curriculum. So we have it's 30 credit hours, so it's done 15 and 15 over the semesters typically, and right around half are pure electives. And so students can customize their study of focus in a way that makes sense for what they're interested in and for their career path. And we have opportunities for study abroad. We have opportunities for clinical ethics rotations. And depending on what you're studying, it can be up to 160 hours in the hospital setting. And that means that we need personalized advising for each of our students so that they are able to think about their career path and how these courses can help get them there. So to transition from talking about just the master's overall to more specifics in our curriculum and how our concentrations fit into that. So by default, all of our students are in what we call the traditional program, meaning that you have some core courses, as you can see on this list: Foundations in Bioethics and Medical Humanities 1 and 2, Clinical Ethics Rotations, and our capstone. And for those who are in the traditional program, your electives are entirely open. So as long as they are related to bioethics and medical humanities, you can take a variety of options. For those who want to dive into one of our concentrations, either medicine, society, and culture, research ethics, or health policy, it really allows you to tailor. So some of these slots that are regularly electives are now designated to focus in on that area of concentration. We'll talk more specifically about the health policy courses in a moment, but medicine, society, and culture and research ethics are just as popular as our health policy concentration. Both of those concentrations allow students to deep dive in exactly those topics with a variety of opportunities as well. So let's talk more about the health policy concentration. Dr. Loue, do you want to talk a little bit more about like the goals for this concentration, and maybe even just a snippet of like why was this an important enough topic for us to have a concentration? Oh, you're muted.
So if you look at the issues that the country is facing on multiple levels, right, in the area of health, we see issues around abortion. We see issues more generally around reproductive care, around access to care for anybody, right, in any context. Issues around insurance. Should there be a single payer program? Should there not be? We see an increasing amount of literature dealing with issues of disability access, transhumanism, right? And all of these raise different ethical issues. And in many cases, policies are either undergoing examination and revision, or we haven't even yet formulated policy. So that in some areas, the science is ahead of the policy, right? And it's ahead of the bioethics. And so it becomes really important to have that the country has a critical mass of individuals, a cadre of individuals who are trained to look at policy not just from an economic point of view or a pragmatic point of view, but to really examine the ethical issues. And how do you put everything together in a way that's going to work, right? So that's really, I think, one of the primary reasons. And so the courses are really designed to help students learn how to analyze policy, how policy is formulated, how health policy really crosses disciplines. So when we talk about health policy, it's not just medicine, it's not just public health, right? But we have environmental policy that has health implications. We have immigration policy that has health implications. We have welfare policy that has health implications. And traditionally, we haven't really thought about the bioethical aspects of those different kinds of policies because they're not thought of in the context of health policy. And so the idea is to really bring that together and understand how these different domains interact sort of at their juncture to affect policy, health policy, and the bioethical issues that are involved.
Yeah, it's super helpful to get a better framework of why this matters, and 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 how wide policy really affects us and our country and the world really, and culture
Right.
and those things. It's much wider than I think a lot of us anticipate.
Yeah, I would agree.
So Kennedy, I'd love to hear from you of like you've taken these classes, you've studied this material. Is there something that you've learned in particular, maybe in this concentration, that has really stood out to you?
Yeah, so Dr. Liu kind of alluded to this a bit earlier, but within the discipline of health policy itself, there are so many disciplines that make up it. And I mean, I even reflect on the writing assignments that Dr. Liu gives us, which are always actually a blast to learn about, if anything. We talk about like urban sprawl and like obesity, reproductive health, a wide variety of topics that you don't even think could relate to health policy in a way and bioethics. And then she asks you to take a step back and look at it from the role of a bioethicist and see how this change and whether we're this last assignment we talked about construct a mall or not in a certain land plot and to think about the health implications that this policy might have as well as the ethical implications is really interesting to see how like day by day we make these decisions and they might have short-term long-term effects on our health. So it really puts into perspective what the people like I guess above me in policy have to consider and how it impacts different ways.
That's really great to hear. Not only is the content you're learning interesting, but the actual assignments are
Yeah,
enriching.
they are. They are. Makes them fun for sure.
So speaking more about the courses, so the way that the concentration is constructed is there's 3 required courses. There's formulation and analysis of health policy. Students take that in the fall semester. I know, Kennedy, you said that initially you were just interested in this course, but it was this course that led you to officially taking the concentration.
Yeah. It was really cool. I mean, I learned a lot. We talked about like some of the initial readings were tough, but I never had readings like challenge myself so much, and especially to learn about it and have Dr. Liu break down the concepts was really cool. So you talk about this like heavy how health policy is made and how policy is made, and then you get into like the case studies where we learn about a new topic every week. But it was definitely very helpful, and it made me realize how complex policymaking is in the first place.
Absolutely. So the second course is case studies in health policy. That's the 3 credit course. And it really partners well with the final course, which is the health policy practicum. And Dr. Liu, I'd love for you to talk a little bit more about this practicum experience for students, because it's not just sitting in a classroom every single week. And I think that's what makes part of what we do in our concentrations unique.
Right. So the health policy practicum is really geared to individual interests. So students have the option, for instance, of doing a deep dive and in research on a particular area that they're interested in, or they can be placed with a nonprofit organization or with an IRB or with a faculty member who does policy research. And so there's just really a large number of options. And again, it depends on the student's interest. So we actually don't meet that often in class. We have maybe 3 or 4 group meetings. Students are really, the time is really devoted to the practicum experience itself. That's what's really important. And then at the end of each semester, students prepare an essay and a presentation for the whole class to talk about what their practicum involved. So just as an example, and Kennedy, maybe you'd like to speak to this, Kennedy has a really, I think, innovative practicum this semester looking at reproductive health and reproductive health policy. So Kennedy, I don't know if you'd like to say something about that.
Yeah, sure. Well, the great thing about having Dr. Liu as the head of this program is that she has a lot of connections. So I was thankful to be connected with a professor in the law school, so Dr. Jessie Hill, who works in reproductive health. So I was able to actually have a chat with her over coffee, which was nice, and talk about my interests. I have repetitively, I don't know, I've really been interested in reproductive health, so I was really happy to be able to express, like, I gave Dr. Liu a bullet point of things I was interested in, and she went above and beyond in trying to get someone to match my interests, which was great. But I've been able to attend different stuff led by Dr. Hill and have conversations with her. She's given me a lot of interesting readings that I haven't, of course, she's like a lawyer, so I'm not really familiar with that side of things. So it was really interesting to be able to read the actual cases and the literature that were more on the law side of things. And then she was also teaching this class that I was able to audit, that was made up of both law students and med students. And it was really cool to see their talk about, like, knowing the biology of things, but also knowing the law of things, kind of bringing it together to the perfect bioethics class. But the way Dr. Hill mediated it and added to discussions was really cool. And then this last week I went and I was able to hear a bunch of student presentations about different topics that they were passionate about. So it was really cool to learn about, but also experience this class that I wouldn't have heard about if it wouldn't have been for this practicum. So yeah, it's been fun so far.
That's amazing. I love hearing stories like that. So I know these are kind of very large questions, but one of the things we often get asked is how has the program or the concentration like helped with career goals or change them? And Kennedy, I'd love to kind of hear how the health policy concentration has kind of impacted your career goals.
Yeah, so I am going to pharmacy school next year at the University of Southern California. So that is going to be my next steps. But the nice thing about being a pharmacy, like going into pharmacy, is that you are doing a lot of project-based work. That's most of your day. So that's definitely what I'm passionate about. Like I said, I've done some stuff in pop health, but I really want to get involved in administration in the hospital, which was why I enrolled in this master's program in the first place, but I've really been able to narrow my focus into how I want to attack that, not only from my interest in pharmacy, but also from a health policy perspective. I mean, I've done a lot of research and we've talked a lot about conscientious objection and how pharmacists can really play a role in that. So that's something that I'm really passionate about. I also don't know if this is because I hang out with Dr. Loue so much, but I do see myself getting multiple degrees in the future. Um, so I don't know. She's kind of inspired me to um, continue education, but also I think I want to get involved in academia in the future because of that. So yeah, I have a lot of different interests, but this definitely helped me realize that, I mean, I don't think my education is done after my pharmacy school, just because this program has made me realize how much cool stuff there is to learn and how much I don't know. So, like, I still don't know. So, I guess it just made me inspired to continue learning, but it's definitely reinforced my decision to go to pharmacy school and continue with that pop health policy project based mentality.
That's great. I love how you have a career in mind, but it's not just focused on one thing. There's a lot of additional considerations to your career potentially, and that's great. And
Yeah,
I, I will say, Dr. Liu, I don't know that anyone is going to ever have as many degrees as you.
no,
And
no.
it's
I mean,
such a
maybe I'll step
wide
in
knowledge
money.
base.
That'll be But yeah, I think that what health policy has made me realize is that my position as a future healthcare provider really allows me to have this voice. And if I'm well educated on it, then I can really help with pushing policy forward. So this has been a great, like, very, like, little floor to where I see my future going as a future pharmacist. So I feel a lot better going into my future role thanks to this concentration.
As Kennedy and Dr. Liu, you both talked about so much how many different fields overlap with health policy. And really, in my view, it's the best way to move forward when we want to make changes to involve as many different disciplines and expertise as we can. And we do that a lot in bioethics.
Yeah, I
And
don't go ahead,
I'm
Dr.
sorry, go ahead, Kennedy.
Okay, I kind of said something, but I don't know if we were all frozen. But I said that I really feel like this has provided me with a foundation of how I want to be as a healthcare provider. Um, because there's a lot as a stakeholder that we can do when looking into policy and pushing for policy. So I think it's really set that foundation for how I want to be an advocate for my patients and future patients. And it's really let me have that foundation of education that I think will make me even more successful in my future career. So,
Yeah, and just as examples, some of the folks in the policy concentration, Kennedy's going on to pharmacy school, someone else is going on to medical school. Two other people are looking for positions as program managers or some other position that will allow them to have input into policy. So I think that there are just so many possibilities. One of the other students who is taking the practicum is going into veterinary medicine and is very concerned about policy around research with animals. So there are just so many professional options after finishing the bioethics program and the policy concentration.
That's great to hear. So for the sake of time, I'm gonna kind of quickly go through. So for those who are interested in applying, we do have a number of things that are required for the application, but I will say it's a pretty straightforward application process. Submit all your materials. We interview everyone who applies. And typically, once we have a completed application, it takes us about 2 to 3 weeks to render a decision. So rolling admissions, we are really efficient with those. That's one of my goals with our admissions team. For those who are interested, we have something called student assistantships. This is a great opportunity for students to get involved in either a teaching, research, or administrative role. And in exchange, students can receive partial tuition waivers. We also have, traditional financial aid options and more information around this is available through Grad Studies. If you have more questions about this, please let me know and we can talk in more detail. In terms of deadlines, our next deadline, our priority 2 deadline is May 15th. If you are interested in applying for our student assistantship programs, you do need to submit your master's program application by May 15th. You will then receive the link to the student assistantship application, which is due on June 1st. Our final program deadline for this upcoming fall is August 1st. As classes start at the end of the month. And as Kennedy probably can attest, the program goes very quick because it's 1 year. And so it seems like yesterday I was welcoming everyone to orientation and we are counting down our last month. So I'm going to look and see if there's been any questions submitted. But one of the questions we typically get, and Dr. Loue, you might be able to answer this just with your vast experience and knowledge, is, with the way that our master's program is structured, but specifically the concentration as well, what makes this particular program unique and stand out, in terms of what individuals are looking for with master's programs?
So I think assuming someone wants to follow sort of the traditional program, right? One of the strengths of the program, I think, is the ability to have a clinical rotation. Very few programs at the master's level provide that kind of opportunity. And I think another real strength of the program is that it allows students to either follow a concentration or to almost design their own program with their electives, right? So let's say that they're not particularly interested in following one of the concentrations, but they are interested in something else. Well, they have so many electives, almost half the credits, right, are electives. So they can really put those together to focus on a particular area.
Yeah.
I think and the faculty in the department come from all these different disciplines, which I think really adds to the richness of the program.
I think so too. I think it also, because of the different expertise, the different disciplines, it allows those students to have that flexibility within the curriculum because they can find someone who has experience in that discipline or can create contacts or ideas. It really allows for breadth in the breadth of experience, but also depth of experience, which I think can be really important. So I'm not seeing any other questions submitted, so I'm going to wrap us up. I do want to say that if anyone has questions about anything you've learned today, or maybe some things are still a little unclear, Or the question might be, am I the right fit for this program? I'd love to be able to hear from you and do a meeting and have a discussion on how this program could potentially fit into your career path. Um, we love to be able to have those meetings. And if I can't answer the questions, we'll connect you with the person who can. I want to thank Dr. Loue and Kennedy for joining us today. Thank you so much for talking about the health policy concentration and your expertise and your experiences. I think it's invaluable. I can't speak to everything in the health policy concentration, but you both can. And I love that, that we were able to hear from both of you.
Yeah, thank you for having us.
Thank you so much, Dr. Jeanette, for organizing this, and thanks to everyone who came to the webinar.
All right. I hope everyone has a good day, and we hope to hear from you. Thank you so much.
Thank you.